Happy Friday, everybody. Welcome to the internet's absolute favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Shannen Doherty's plastic surgery woes. We're going to tell you about what she's been talking about. And then, is being a doctor worth it? I'm going to let you know. And then finally, Sarah's going to tell us about some of the best at-home skincare products, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is the wonderful Sarah, who I have to say, hair looks absolutely amazing today. Like, I saw her in the hall when I was coming into the studio. I was like, who's that girl? And I was like, oh, it's Sarah. But no.
Thank you.
Looks great.
My lion's mane.
Yeah.
Looking good.
In the box, we got Travis. What's up, man?
Hey,
how you doing?
How's it going? Dr. Herman, I'm just waiting on my hair compliment as well.
Your hair always looks fetching. It's always top shelf.
I'm joking.
I mean, but if you came in with some different style, man, like, I mean, I definitely would,
Next week, I'm coming in with
all right.
Color.
Okay. I'm interested to see that,
Bennett
actually.
Rodman color.
Yes, indeed.
I get hooked up with my my color person, you know. I got a person.
Right,
She's really good.
I
Yeah.
got you. I want tiger stripes.
Okay. I think we should do that.
Right.
Everybody having a good week? Anything interesting happening in everyone's lives?
Yeah, having a really good week.
Yeah.
I'm taking Avery to a little like Taylor Swift, like not the real Taylor Swift, but like a little tribute band that they're playing
really?
in Denton. Yeah.
Interesting. I bet that would be really cool. Taylor Swift.
She's pretty
tribute band.
good.
Is she?
Yeah, I looked her up on like YouTube and stuff.
Yeah.
She's pretty good.
When is that, tonight?
It's tonight and tomorrow. It's for
Where-
that little festival called She Rock, and it's all women.
Is it at
artists.
in Denton?
Uh-huh.
I may have to ask you about this after
It's
after
for
the
girls.
show.
It's like for
yeah, Danica might like that. Yeah.
women's health and stuff.
Speaking of concerts, this is kind of funny. So Olivia Rodrigo's here tonight. Man, so my daughter wanted to go, and I mean, I'm not the hugest Olivia Rodrigo fan, but I would go to the concert because I love live music. But oh my God, the tickets for that show is like ridiculously stupid.
Yeah, how much?
Like insane. So like the worst ticket in the place, $500. Like I'm talking like up in the rafters where you need like oxygen because the air's so thin. $500. It's insane. I mean, of course they're all secondary market at this point. And so my daughter and I made this deal. We're gonna like wait literally until the last minute because there's still like a lot of tickets out there and see if the prices like bottom out like right before the show starts and then go last minute. So I don't know. I don't like doing like that because I like to know are we gonna go or not.
I looked at going to a big concert, like a Blink-182 concert, because they're like re-touring.
Yeah, I've seen Blink-182.
And they're super expensive too.
Yeah.
And I looked even like super early. It's weird.
Well, the problem is all these concert tickets get immediately bought up as soon as they go on sale, and then you're buying it like a resale ticket. I mean, you never get tickets, the original ticket, anymore. It's just crazy. It's super annoying because, not only you buy the tickets, like they add on about a third of the price for all these service fees.
Yeah.
Because the tickets are really, the cheapest one's like $350, but then there's a $150 service fee, which makes no sense.
What are they serving you?
I guess the ability to buy a ticket at an outrageous price is what they're serving you,
don't
and then they
know.
charge you for it. Yeah, I really hate all of it. I mean, it is what it is, but it's just like the tickets go on sale, and then you can't buy them, and then you have to buy them a second time for a much higher price. It's just ridiculous. I wish somebody would fix that.
I don't know who can.
I mean, the way you could fix it would be potentially forcing, people to maybe have like an ID with the ticket they buy, right? No, I mean that's one way, but then it gets sticky because people bring their friends or whatever.
Yeah.
I don't know.
They need a ticket police.
I don't know, but it's annoying to like pay that much, for a ticket, because you're paying triple or quadruple what they initially sold for. So anyway, I don't know. I'll let you know what happens. But if that falls through, maybe Danica and I will go up to that. Are you guys going tonight?
Saturday.
Oh, you're going Saturday. Oh. Yeah, Danica may hit that thing. Do you have to have tickets for it?
Yeah, but they're cheap.
They're unavailable.
Yeah.
Oh, okay, interesting. Well, I'm glad you told me about that.
That'll be fun.
Yeah,
you
we may
should
hit
go.
that up. All right, let's move on to some segments. So first off, did you guys hear about Shannen Doherty in the news? It wasn't like a big thing. Yeah, it
I
wasn't
know
too
she
big.
is though.
Yeah, right. So we all know Shannen Doherty's from Beverly Hills 90210.
And Charmed.
And Charmed, right? I mean, she was on I always just remember her from Beverly Hills 90210 because that show was so like big back when I was like young, and
Charmed was big when I was young.
yeah. And so I always associate her with that. Well, she has her own podcast now. It's called Let's Be Clear with Shannen Doherty.
Okay.
And so I guess this past week she was talking about this episode that she had where she decided she was going to go to a plastic surgeon, which first off, that's a change of tune for her because like just in 2021, I believe, she went on Instagram and basically was slamming people or women that go and get procedures done to look young. She's like, oh, you need to stay natural and this and that, and well, whatever. I mean, if somebody wants to say that, that's fine.
It looks like she's gotten Botox and stuff in her face.
Yeah, so she's had a little bit of change of tune since 2021 when she made that Instagram post. So she was telling the story about how she went to celebrity plastic surgeon Jason Diamond. I've never heard of that person. Have you heard of him?
No.
Oh, all right. He's probably some Beverly Hills plastic surgeon. I have a friend out there that's in Beverly Hills. Oh my gosh, I'm blanking on his name. He's gonna kill me. Well, it'll come to me. Oh my gosh, I haven't seen him in years and years. All right, I'm gonna come back to that. It's the COVID brain, I think, or something. But anyway, so she went to the celebrity plastic surgeon, Jason Diamond, and she went for what she said is a overall assessment. I guess, like, what are my options for looking more youthful? And she got really unhappy because the plastic surgeon told her that she was a great candidate for a facelift. Which, I mean, she's pretty young. She's only 52 years old. So she was kind of upset about that.
Bradley Cooper was in the news for his facelift.
Bradley Cooper got a facelift? What? No way.
Yeah, I saw it.
Are you being serious?
I'm being serious.
How did I not hear about this?
I don't know.
Okay.
There was like all these TikToks like showing like how his you can see all of the different when he turns his head, you can see like the skin.
The scar?
Stretches.
Oh my gosh, I'm gonna look
And
for
right
that.
here you can see where his beard doesn't go all the way to his ear line anymore.
Oh my gosh. Wow. I'm going to have to look into that.
Yeah, but you can
He's
tell.
pretty young to get a facelift. How old is Bradley
Not
Cooper?
really. He's
old?
in his I think he's almost 50 years old now.
Almost 50? That's my age.
I mean, I don't know. He's the
I mean,
movie
I feel like
star too.
I don't need a facelift. But, well, I don't know. Anyway, so she's 52. All right, so as a plastic surgeon, to me, that's young to get a facelift. Most of the people that are getting facelifts, maybe late 50s, definitely 60s. I've done some as 70s as well. So I want to talk about, is Shannen Doherty a really good candidate for facelift, and kind of talk about what would make you a good candidate or not. So I do think 52 is early. I mean, if you just said is 52 a good candidate for facelift, my first response would be no. That's too young. Because you don't want to do it if you're not going to get enough gain from it.
Yeah.
And you don't want to do a facelift if there are other options which can accomplish what you want to do. And so, I mean, I use myself as an example. I always talk about the fact that I use this laser. I was getting a little bit of jowling right here along here. I mean, just because I'm 49, I'm not quite 50, but and I used laser treatment, and it basically took it away. In just one treatment, and you can repeat those, which I do every year. So just in general, I think that's pretty young. But I want to take a look at her. So throw up that next pic, Travis. And these are all pretty recent, I think within the last year or two. And so, I mean, yeah, she's a beautiful woman. In these two pictures, I would say absolutely not. To me, she doesn't have enough fall of the face to warrant doing a facelift. She doesn't really have, really heavy nasolabial folds, which is that line kind of right under the cheek, and she doesn't have significant marionette lines, which is the lines that come down from the corner of the mouth. I will say she does have a little bit of fall of her platysma muscle, which is the muscle on the neck, and you can see it in that picture on the left where she's wearing the blue jacket, that kind of line of her neck. That's kind of a classic sign of the deep structure of the face falling. But I found one picture that's maybe a little bit less flattering, and not to throw up her worst picture, but if we're talking about she needs a facelift, we need to look at her face. So throw up that next one, Charles. Yeah, so in this one, and you kind of have to like really kind of zoom in. I mean, she does look like her skin is aged a bit more than I would expect for 52. Like, especially looking at her neck.
Yeah, that doesn't even look like her.
Yeah, and I don't know, maybe it's just a bad picture because all the other pictures look pretty good, but people you use makeup and filters and stuff. And I hate to be critical about people, but we are talking about is a facelift right for this particular person. She does have a lot of fine lines in her skin. If you really kind of zoom in on that picture, you can kind of see them, and you can see that the skin of her neck looks a bit aged. And so the first question would be, okay, well, if we're saying that she looks a little bit more aged than her actual age, why would that happen? Sun exposure probably. I mean, I don't know if she's a smoker or was a smoker. That's really not good for your skin as well. And overall genetics. I mean, she just may not have although she looked great, when she was young, maybe her genetics are that her skin ages faster than the average person. So even looking at that picture though, I mean, my opinion, I would say she's not a great candidate for a facelift because I think she's probably a little bit too early for it. To me, her biggest issue is really the fine wrinkles in her skin, which there's some great lasers that can take care of that. The only thing that might push her a little bit more towards surgery is none of the treatments which will tighten skin or get rid of those fine wrinkles will deal with that platysma band fall, which is that kind of line in the neck. I mean, you can tighten the skin, but if the muscle's kind of falling, you really have to do surgery to fix that. But for me, she's just early.
What kind of surgery is that called?
It's a neck lift.
Oh, okay.
Yeah, neck lift. And pretty much we do facelifts and neck lifts always together. I mean, even if somebody doesn't have as much fall in one area because the incisions are the same and the recovery's the same. I mean, I encourage people to do it, and it's not, try to get money out of them. It's because you're doing the incision, you're doing the same dissection. I mean, just go ahead and do both if you're in there. Is my opinion. But if she came into me, and especially because she doesn't want surgery. I mean, she said that in her little podcast. She's like, well, I was really upset that this doctor told me I was a great candidate for facelift because I don't feel like I'm at that point yet. And I agree with her. I do. I disagree with that doctor. I mean, it wouldn't be crazy to do a facelift on her, but I just don't think it's the right answer.
Yeah. I feel like that's more of like a keeping up with the Joneses.
Yeah.
For her to do the facelift.
Yeah, I agree. For her, I would try to get rid of some of those fine wrinkles, like with laser treatments, which are great. Morpheus 8, which is we always talk about, is great. And then, use the Botox and maybe just very light fillers. You know how I feel about heavy fillers, but light fillers just to kind of mask things. I think that she could, get what she wanted without going through the big surgery of a facelift and neck lift. And so, so I disagree with you, Dr. Diamond. I don't know who you are. You're probably a great guy, but I just think that you're wrong on this one. Sorry. And then I wanted to also talk about, okay, well, if you want to avoid having a facelift as long as possible or maybe forever, what are just some quick tips that you could do to make that happen? And it does start when you're young. I mean, you can't start doing these things when you're Shannen Doherty's age and expect, I'm not going to have surgery. So, I mean, I think good skincare, which you're going to talk about later, is important. And starting young is good. Avoiding sun exposure. Sunscreen is important. I mean, you can go out in the sun, but wear sunscreen. The sun ages you so fast, and I really think she probably has a lot of either sun or tanning bed exposure based on how her neck looks. Like that picture is just classic for somebody who's been in the sun.
Yeah, she was from the age of that.
Oh, totally.
Trending. It was trending to go.
Yeah. Avoiding smoking is important. Smoking does age your skin. Starting Botox early, and to me, early is like 30. I'm not sure there's a lot of benefit to do it in your 20s unless you're just really kind of going overboard. And then skin treatments like intense pulse light, lasers, the microneedling's good. And then, when you get a little bit older, start using a little bit of fillers and Sculptra. And I think you could probably avoid a facelift, pretty much your whole life if you did all those things. I mean, if there's money
long enough
involved
to really not care.
What's that?
I said long enough to where you're old enough to where you're like, I don't care.
Yeah, you hit your late 70s or 80s, you're probably like, wow, I'm probably good.
Yeah.
I mean, you say that, but people are doing stuff, later and later these years. So, but yeah. So
What's the oldest you've ever done plastic surgery on?
80s.
Nice.
I mean, there are some people out there that are. What I'll tell you, like bigger surgeries, 70s, but things like where I've had women that had old implants that need to be swapped out or removed, and I know that some have been in 80, early 80s. But you get some like people that are really still pretty youthful, even in their 80s these days, because they take care of themselves and people are living longer.
Yeah, my mom definitely in that bracket.
Yeah, my mom too. My mom's like 87, about to be 88, and she still works like almost full time. It's insane.
Yeah.
Like she's got so much energy. I mean, it's kind of impressive, honestly.
Yeah.
But anyway, I just wanted to recap this segment really quickly. So today we were talking about Shannen Doherty, who was really upset because she went to a plastic surgeon for an overview or a general assessment, and he said that she's a great candidate for a facelift. We looked at her pictures, and I disagree with him. I think she's a little bit early. Also, at her age of 52, I think that's a little early to have a facelift. I would have recommended some non-surgical therapies to see if we could get the result that she wanted. And also, if you want to try to avoid a facelift as long as possible, there's a few tips. Good skincare starting young. Avoid the sun by using sunscreen. Avoid smoking. A little bit of Botox always help, and then some of these skin tightening procedures can help you potentially avoid a facelift into your later years. So. Yeah.
Nice.
Good stuff. All right.
Educational.
Okay, so the next segment we're going to do actually comes from one of our viewers.
Okay.
And I really hate that I forgot to find out exactly who that viewer was before we started the show. But what I'm going to do is I'm going to find out and I'm going to tag him in this segment. It was one of those things that my people post about, ask, suggest a topic.
On Instagram?
I can't remember. That's why I couldn't find it, because it could be Insta or YouTube Shorts. I'll have to look for it. So to whoever suggested this, one, thank you, and
Thanks.
two, sorry I couldn't find your name right before the show to give you a shout out, but I do appreciate it. So the segment we're going to talk about is being a doctor worth it, right?
Okay.
Which, I mean, on its face value, I think most people, well, I don't know, what would you say most doctors do? You think they'd probably say yes, right? Or no, or I don't know, what do you think?
I mean, I hope they do.
You'd
but,
hope they do, yeah.
Because, I mean, that's like,
well, I mean, I think a lot of people get into careers and they end up, not necessarily liking them,
right,
or saying this
true.
wasn't worth it.
Yeah.
So, I'm going to tell you, 20 years ago, I think that the answer to this question was 100% absolutely yes, without question. I would say now, today, I still think the answer is yes. It's kind of like, yeah, yes.
As long as I can get my student loans paid off.
Well, I mean,
kind of
and that's what I'm going to talk about. I do think, for me, yes, it is worth it. But, it's not quite as an easy yes as I would have said 20 years ago. And so what I want to do is I was going to go over what I think the pros and cons of are being a doctor, because there are people out there, either young people that, might watch this that are in college and thinking about a career in medicine, or maybe older viewers, their kids. So I was going to kind of go over the pros and cons. I like to make a list.
Yes.
Pros and cons. So, well, first off, for a pro, I do think being a doctor still is considered fairly prestigious, right?
Yeah.
I mean, it's kind of cool. I mean, honestly, I don't go around telling people I'm a doctor. If people ask,
yeah,
huh?
Just kidding.
No, I really don't. I really don't. If somebody asks me what I do, I'll tell them. But I definitely don't run around calling myself doctor or ever leaving my name as doctor.
No, you would, if you were at at normal places, I would have never known.
Right, because we met like in a normal place.
Yeah.
Yeah. So anyway, but I do think that being a doctor is still prestigious, and some people like that. For me, I'm kind of like, it's not that big of a deal. Another big pro, I think, is if you have a career where you're really helping people and, even potentially saving lives, there's a lot of fulfillment to that.
Yeah, for sure.
It's like, I mean, I don't want to dog any particular job, but I mean, there are some jobs where it's like at the end of the day, and I've had many jobs, but so I can say this, there's some jobs at the end of the day you do your job, you're like, what did I actually do, I think with being a doctor where you're helping people and potentially saving lives, I mean, that's very cool. And I do like that. I will say that another big pro about being a doctor is it does offer you countless options to find a specific specialty to fit your personality.
Right.
and that's cool too. I mean, there's so many specialties out there and so many ways that you can go with being a doctor that I think almost everyone can find something that fits them, because not everyone's cut out to be a surgeon and not everyone's cut out to be an OB like my wife or, whatever other doctor specialty there is. I mean, some of them just don't have the characteristics that are going to appeal to people, but there's so many that pretty much anyone can find something that fits them. And then lastly, the one that probably most people think about when they think about being a doctor, I mean, financially, it's a safe bet. It's a safe bet to be comfortable. And I would say that you're not going to get rich being a doctor, or at least there's no guarantee of that.
Yeah.
But, I kind of looked up some figures, and, the average doctor salary in the United States right now, and it varies, but it was ballparked around $300,000 a year. I mean, that's good money. I mean, no one can,
for sure.
complain about that. And I know that doctors they are in the group of professions most likely to be like in the 1% of earners. So like there's this potential for like good earning. I mean, I think that it's and I'm gonna talk about this in the cons, that, it has changed, and I'll just jump right into that. So going into the cons, the money ain't what it used to be, for sure. I mean, you're gonna be comfortable, but there were doctors making huge, stupid money, 20, 30 years ago, and that money was more valuable than it is now. I mean, because of inflation.
Yeah.
So I think that is one thing that is definitely a negative, is that the reimbursements, like, how much you get for actually doing your craft are going down. It almost seems
Well,
like
there's isn't there different income levels in terms of what specialty you pick? Like if you're just going to be a family doctor at like a family
100%.
practice, it's probably lower.
Absolutely.
Versus like a heart surgeon.
Correct. The more specialized you are, the more money you tend to make.
Okay.
For sure.
So like, is it more like what specialty is like the most like cost benefit versus like?
That's a great question, Sarah.
Like time, your time, the college education.
Yeah, it's a brilliant
all that
question,
kind of
because
stuff.
I did 8 years of residency and fellowship, which is insane. I mean, that's just ridiculous, because you're getting paid very, very little to be a resident or a fellow. So, what pays really good but isn't a long residency? I mean, probably something like emergency medicine. I think it's still 3 years.
Okay.
They may have lengthened it. I don't know. Some of the residencies have changed a bit with the work hour restrictions that they put in. But ER makes pretty good money. Anesthesia makes good money. I think that one's 4.
Okay.
But then again, you have to like what you're doing, right? And so, it's a good question, but I think picking a specialty based on money is probably the wrong way to go about it.
Yeah.
I mean, you should pick what you're gonna like.
Yeah. Well, in terms of like time, because whenever I think about like if I just wanted to treat like patients at like a family clinic, like I was trying to be a PA.
Oh, were you?
A long
Cool,
time
yeah.
ago.
Yeah.
And that's all I really wanted to do. So
Yeah.
I was like, that's the route that I should go versus getting an MD and just doing the same thing.
Right. Yeah. Unfortunately,
Yeah.
I think
PAs have to work under a doctor, but yeah.
Correct. Yeah, I think family practice and pediatrics are probably some of the lower ones, and I personally wouldn't want to do that, because in order for them to be able to make a profit, they have to see so many patients.
Right.
Like, it's insane. My practice is the complete opposite. My clinic days are I mean, they're busy, but I spend a lot of time with each patient, especially the new consults anyway. And so I get time to talk to them, and I like that. I don't like to be rushed. So I was not interested in family practice or peds because of that. I mean, for other reasons too, but.
Yeah.
So other cons, getting into med school is tough, like really tough and very, very stressful. And so, you have to be aware of that, because it is definitely a possibility that you don't make the cut.
Yeah.
That
I didn't make the cut getting into PA school.
Oh, you didn't? Oh, you could
Obviously.
have tried it again. I just figured you'd probably change your mind.
No, I just didn't get in. But yeah.
Well, a lot of
it's
people,
hard.
reapply and stuff. I mean, that does
I
happen.
didn't. I was just like, ugh.
You're like, try something different. But yeah, getting to med school is tough, and you have to have a backup plan, because if you like me, I got a degree in biology. What am I gonna do with a biology degree if I don't get in med school? I mean, you have to then create a new pathway. I will say that being a doctor can be very stressful.
Yes.
Lives are at stake. There's also the stress, like risk of lawsuits. That's something that not a lot of specialties have to worry about. And you can see that because the suicide rate for doctors is twice the level of the general population, which is pretty wild. Another downside, a lot of the autonomy is gone. You know, one of the reasons I went into medicine is I love the idea of being my own boss and, you know, having my own business because that was actually pretty popular, you know, many years ago when I was thinking about what I was going to do with my life. That's completely changed.
Yeah.
People like me, because I do own my own practice. I'm a solo practice guy. I own my own business. That's very rare these days. Most people either get employed by a medical school, a hospital, or a large group.
Yes.
And when you do that, you become a wheel or a cog in the machine, right?
Yep.
And you lose, you know, any type of autonomy. Not any type, but a lot of autonomy.
But then you don't have the stress of running your own business.
That is true. Very true.
Because I know how stressful it is,
Yes.
and you know how stressful it is.
Yeah, I do, and that is, you know, that is one of the downsides of being solo practice is, you know, you're not taught, and I actually have that on here too. If you want to go solo, you have to know business, and I mean, I had a lot of jobs, so I at least had some background in business, but I never had any like formal training in business. And I will tell you, I would do things a lot different if I was starting now versus, you know, what I did back when I actually started. Not that it's been bad. I mean, you figure things out, right? But I mean, I could have saved a lot of heartache and money if I had, you know then what I know now.
Same.
Yeah. Debt. Be rare to go into debt to do this. I mean, you got college, you got med school. Then when you go to residency, you don't make enough to really pay back anything. So like for me, I was 35 years old when I actually started my real career. I mean, that's crazy. And I'm still paying my student loans. My wife and I started paying our student loans in 2002, and we're still paying them. I mean, but we're almost done.
Yeah.
But we've been paying for whatever it is, 22 years.
What is your wife a doctor? What is her?
OBGYN.
Okay,
Yeah,
that's what I.
But she doesn't do OB anymore. She kind of gave that up.
My mom asked me that. She was
did
like,
she?
"What does his wife do?"
Yeah.
And I was like, "I think she's a doctor too."
Yeah, she's an OBGYN, but she gave up OB, which I don't blame her. That's super stressful. And then she got her MBA, so she still sees patients. She works up at the university, and she's like the head honcho up there now, which is actually a really, really good job. But yeah, debt. So the average debt for a doctor graduating from medical school is $215,000. So you have to pay that back, right? I mean, and you will be able to, but it's just having that debt hang over you sucks. And then the headache and kind of the bureaucracy of it, dealing with insurance companies, dealing with hospitals. I mean, I do a lot of work that's not really patient care because of insurance companies and hospital bureaucracy, and it does weigh on you. I mean, it's just another layer of stress. But all those things, I mean, I like what I do personally. I really do enjoy it, and it's stressful, and I work a lot. I should have mentioned that. You're going to work a lot. I generally work 7 days a week. I mean, I almost always work 7 days a week. Now, I may not work, 8 hours, but I'm doing some work on the weekends.
Yeah.
Pretty much.
You're not like scot-free.
No, not at all. And, so.
You don't check out on the weekends.
But as I said, I mean, I think the answer is yes, it's worth it. I always wonder if I had put as much time and effort into, say, like a business, as I had going through med school and residency. I mean, you're probably going to end up being successful as well,
If you pick the right trade.
What's that?
I guess if you pick the right trade of your business.
Yeah, yes. But it's like when you put so much time into being a doctor, if you have that amount of time to put in any career, you're probably going to be successful, right? So it's like, well, because I always think about, being a doctor is a safe bet, right? I mean, if you go be a doctor, you always have a job, you always make decent money. But if you work that hard at anything, you're going to have a job and you're going to make decent money. So I always tell people, though, if I can talk you out of being a doctor, you shouldn't be a doctor. Because we'll get students and, sometimes follow me like, what do you think about being a doctor? I'm like, oh, don't do it. Like, don't do it. And if I can talk them out, then they shouldn't do it. Because people say that to me, but if somebody says, look, this is what I'm going to do no matter what, then they're probably going to be all right.
Yeah.
Yeah. So anyway, so is being a doctor worth it? Yeah.
Yeah.
Yeah. All right, Sarah. Are you going to educate us now on some home skincare products?
Yeah, some devices.
Nice. And
the reason I picked this topic is because every time I'm on TikTok or like Instagram Reels, I keep getting these ads for like this laser mask.
Is it like a
It's like a laser mask? Yeah, I just keep getting them. So I was like, I want to know about these things.
Okay, educate us.
And so I found there's like a top 3.
A top 3.
Yeah, for these
These
devices.
are the most popular at-home skincare products being
Yeah.
advertised on social media. So if you're on social media, maybe you guys have seen
you've
this.
probably seen them. And now, since I've researched them, now I just keep getting ads for all of it.
Oh my God, it's never gonna end.
It's never going to end now. So if you could throw up the first slide. Yeah, so the first one
LED
is
light
LED
therapy.
light therapy devices.
Yeah.
And this is the first one that was advertised to me. And this is what started the whole thing.
Yes.
So these use wavelengths, different wavelengths of light to target various skin concerns such as acne, wrinkles, and hyperpigmentation. They are non-invasive and can be used at home to improve skin texture and tone.
I do know a little bit about these. We have some of these at our office, as a matter of
But they're
fact.
probably more efficient.
Yes, so anything that you get for at-home use that also has an application in a doctor's office is gonna be a lesser version of it.
Yeah.
But,
I think this is literally for daily use.
right, yeah, but if you are able to use it more frequently, because you're not having to go to the doctor's office to do it, I mean, there are some benefits to it.
Definitely. And we're going to talk about it. So the next
Okay,
slide.
all right.
The next slide is the most popular version of this. So this
Okay.
is from Dr. Dennis Gross Skincare. So these are the
So
devices.
this guy made his own light therapy devices?
And there's one for like your lips too.
Oh my gosh.
So the one down there, that one's like $455. I can't see that far, right?
Yes.
That's how much one of them costs.
Okay, yeah.
That's like the
$455.
average that I found.
Wow.
But that's like the most popular one. And this is the one that's always advertised to me.
Okay.
Anyways, so you can see results from this in like 4 to 6 weeks if you
The light
use it
therapies?
daily. Obviously, it's LED light therapy. It targets those skin concerns we were just talking about, so acne, wrinkles, and hyperpigmentation.
Yeah.
It's at-home use,
Right.
so it's convenient. And you can see some results if you're consistent. So that means
Yeah.
if you follow those instructions on the little manual thing, you'll be good.
How long did you notice, or did it say how long you have to use the treatment?
4 to 6 weeks.
No,
to
like
see-
each time you use it, how long?
Oh, it's about, so all of these devices are going to run between 10 to 20 minutes a day.
Yeah, that's about right. Yeah.
Yeah, so it's just literally just enhance all health
Yeah. So
on your face.
I know a little bit about that red light therapy. Yeah, I mean, it does what you say. It treats pigmentation. It goes to create collagen to help with wrinkles. You know, is it as good as a invasive therapy? No, it's not.
Right.
But I mean, is it better than doing nothing? Yeah. I mean, there's a lot of research that shows that these are helpful. You know, they're definitely not miracle cures. And you know, if you use this thing with the thought that it's going to completely correct some big issue, like you have a massive amount of wrinkles, you're going to be disappointed.
Yeah.
You know, that's made for people that are, you know, your age bracket, maybe my age bracket, where, you know, we're not kind of too far into the aging process, and it'll help a little bit.
Yeah, that's what I found too.
Cool.
The cons of it.
Oh, there's some
Yeah.
downsides. Okay.
Yeah. So, I mean, they're expensive. And if you
Yeah.
don't use it properly, it's not going to be worth it.
Right.
So, if you're not consistent, it's not going to work. Some people have sensitivity to those light, like wavelengths. So it's like if you buy it and you realize that you're like allergic to that type of wavelength,
Yeah, or
then
you
just
react to it
wasted.
strongly.
Yeah. Because like I'm allergic to the lights in tanning beds. So like imagine if
Allergic how, like it gives you a sunburn?
it gives me like a rash all over my
Really?
body. Yes.
Do you think it could be like some of the oils or something, or?
No, I never put any oils
I mean, it's like
on me.
ultraviolet light.
I don't know what it was.
I'm gonna have to like look into this.
I don't know if it was maybe because like
Because
my
I think
skin is
if
just
that
like
did that, then the sun would do it to you. I mean, they are a little bit different. I think we talked about this. They're UVB.
maybe it's just because my the sweat maybe.
Yeah.
I don't know, but I will never do that because
Good. You shouldn't do that. It's bad for your skin.
I don't want to. Yeah. And it's not going to provide like super dramatic results like you would
Correct.
see
Yes.
if you went to like a med spa like you
Yeah,
gonna have.
something like that is for people who just want to do everything they can to keep their skin young, and they probably do other stuff, but they do this at home, in between
Yeah.
other treatments.
So like
Probably.
what would you say would be what you could offer?
If you're talking
like,
about
if you
if you're
wanna
talking about
get
pigmentation, like in IPL,
for acne,
yeah.
wrinkles,
Yeah, yes.
and hyperpigmentation.
So
yeah.
for acne and hyperpigmentation, I would recommend IPL. So that's intense pulse light. We use the Cyton broadband light, which is like the brand name. I mean, I can tell you the thing works like a champ. Like if you have like age spots or like dark spots, or if you have vascular spots like little capillaries, it'll strip them off. I mean, just gone.
How many treatments? Just one or just
One
like multiple a
to
year?
3.
Okay.
1 to 3. But that light is very, very powerful. In fact, of all the machines in our office, it's probably the most dangerous because it can literally burn you, like give you real burns.
Would you say that the cost of that would be a little bit more expensive than the
Well, no, not
product?
necessarily. I think the treatments for that are a few $100.
Mm-hmm.
I mean, and so you can like completely remove age spots and vascular spots with 1 or 2 treatments. I mean,
Yeah.
my wife had some on her legs, and we took her up there one day and zapped them, and like they're gone.
Right.
Like-
So, that sounds like it would be more beneficial to just.
Yeah, I mean the thing about the IPL also will help you with wrinkles if you use it like as a maintenance, not a like a
Quick
a
fix.
treatment phase. But yeah, I mean it starts to get expensive. If you were gonna do.
But like if you're like trying to get rid of acne scars, it would probably be better.
So
just
if you're trying to
go
get rid
do
of
that.
acne scars, I would recommend either a laser or like a Morpheus, which is microneedling. That's better. The IPL is good for getting rid of the acne is caused by bacteria.
Right.
The IPL will kill the bacteria, which is the first step in getting the acne to kind of resolve. And then you come over it with, I like the laser for that because it resurfaces a lot.
Mm-hmm.
So if you have bad acne scar and you think that red light therapy is going to fix it, you're going to be sadly mistaken. It will not do it, period.
Well,
you have to
and-
do
yeah.
something a lot heavier.
Right.
Which there are things out there. We have, I'll have to bring some pictures one day. We have some pictures of people that had pretty bad acne that we treated, and like it's amazing. Like it goes from like the deep pock marks to skin that looks pretty smooth.
Nice.
Yeah, but there's some commitment to that. You're committing to the money and the time to come and do it, but they do work.
Yeah.
Yeah.
Okay. Well, to me, it sounds like I would probably go to you versus buy this.
Yeah, I mean it's just cost. I mean you buy that machine, you can use it for years, right? For $400. If you're going and getting IPLs all the time, you're going to be spending more money. But yeah, you mean at the end of the day, you get what you pay for, right? Yeah.
So
Word.
Cindy chimed in. Cindy Hermann chimed in about I think the tanning bed conversation.
Yeah.
She was saying that it could be like a fungus on the tanning bed.
Oh, sorry, Sarah, you have fungus.
Well, 18-year-old Sarah could have used that information.
Where were you?
She did say steer clear.
I was
15 years
like,
ago.
I always thought it was like, oh, it must be the spray that they're using.
It could be, yeah.
The
That's what I was thinking when you said you got this reaction from a tanning bed. It's like it's probably some chemical or
It was
something.
literally only on the parts of my body that were so like my butt.
Oh yeah, there's definitely something they were cleaning with.
Yeah.
For sure.
Anyways, the next device.
Moving on to the next
throw
device.
up the other slide. So the other one is microcurrent facial devices.
Okay, electrical currents. Got it.
Yeah, devices deliver low-level electrical currents to the facial muscles, stimulating
yeah.
them to lift and tone. They are designed to mimic the effects of a professional microcurrent facial treatment, helping
Right.
to improve facial contour and reduce the appearance of fine lines and wrinkles.
Got it.
So, the product that is most popular for this type of device is a device called NuFace, and that's the next slide.
All right. Let's see it.
And if you use that as, well, it's the little device.
Yeah, I see
Those
it,
are
yeah.
the little starter kits. But
Gotcha.
if you use that device,
What are they running?
how it's
200. Got it.
how it's like instructed, you can see results in 4 to 8 weeks.
Allegedly.
So some of the pros are non-invasive, obviously.
Right.
Noticeable results if used consistently. So that's another thing we keep hearing. And obviously it helps lift and tone facial muscles, easy to use, and can improve texture and appearance.
Yeah. So this would be akin to a product called M-Sculpt.
Okay.
Which I've been thinking about getting one of those machines. It applies like more like radio frequency energy to make your muscles.
Yeah, this sounds like it would be better if you want to fix wrinkles. This one sounds like it would be better versus that red light therapy.
Maybe. My question would be is, how effective it is, because I've used M-Sculpt when they brought one of the machines to my office here. They're trying to sell me this machine.
Right.
And so what the machine does is it stimulates your muscles so hard that you build muscle, and it also reduces fat. And I did a full treatment on my abs, because you can literally put this thing on you can get a six-pack.
Did we talk about that for butts too? I
think you could do it on your butt too. Yeah, you can.
It was like
right.
another
Yes.
option besides
doing,
butt
but it
lift.
gives you like
Yeah.
the more flat muscular butt, not like the round Kardashian butt.
Right.
But I did a full treatment of M-Sculpt, and man, it hurts. Like it feels like I did 10 million crunches, because that's what you're doing, except you're just sitting there.
Yeah.
So,
That's one of the cons I think on here. I think mild discomfort.
Yeah.
Some may experience mild discomfort.
Right. So the question is how effective is it as an at-home treatment? Well, it's just like everything. I mean, if you use it every day, you're probably going to see some result from it.
Yeah.
But I mean, if you expect that to, give you a facelift, you're going to be disappointed.
Yeah. I feel like it might make you look a little.
It could help.
Yeah.
It could help. It just would depend on how much it actually stimulates the muscles to work.
Yeah.
Because there's a lot of data that shows that M-Sculpt works very well.
Yeah.
But I mean, that's a much, much heavier treatment than that little guy, I'm sure. So
Yeah.
But
Yeah.
cool.
The cons of it are just like the other one, pretty much, is high initial cost.
Yeah.
So big investment and a big investment of your time.
Right, because you have to do it every single day.
May not provide permanent results.
It doesn't, for
Yeah.
sure, because it's just like the M-Sculpt, you can get a six-pack and then...
It's just like, because it's like
It's like working
electrically
out.
exercising your face.
Yeah, yes, that's all it is.
Yeah.
And so when you quit doing it, you'll keep it for a while. I mean, because when I used to work out pretty heavy, like I kept a fair amount for a long time, and it just gradually kind of goes away if you don't keep doing it.
And then it made certain to say limited effectiveness for certain skin concerns. So
it's not gonna
it
do any
improves
resurfacing.
overall skin texture, but in terms of deep wrinkles and like severe acne, it's not going to do
for
anything.
Sure. Yeah, I wouldn't do much.
Yeah. So to me, I think I would go for this product more for wrinkles versus the LED, just from researching it.
Okay.
But
that sounds
that's
reasonable.
just me.
Yeah.
I feel like the LED mask is more for like.
Probably pigmentation.
Yes.
Yeah, it probably will help build collagen if you use it enough.
Yeah, maybe. Mm-hmm. And then the last popular
What's the last one?
thing.
Ultrasonic skin. Oh, so a skin cleaner.
Yeah, so this is a handheld device, uses ultrasonic vibrations to exfoliate the skin and remove impurities such as dirt, oil, and dead skin cells. They are gentle yet effective at deep cleansing pores and promoting smoother, clearer skin. And the most popular one is this Derma Flash. They also sell those things. They're also really popular for selling those like things that like pretty much like shave your face.
Jade roller? No.
No, it's like looks like a little
Like a
shaver.
razor? What does it do?
It like shaves off like your peach fuzz. I don't agree with that.
Like a
but
razor?
yeah.
Okay.
I don't like it. It's called like dermaplaning.
Oh, dermaplaning. Okay, yeah.
Yeah, I don't really care for that. I think that's weird.
I mean, honestly, of all three things
No
that you've thrown
offense.
up, I think probably that's going to give you the biggest bang for your
Yeah,
buck. If
and
you
it
can get like a
does.
really good cleaning,
Yeah.
I mean, that's good for
So
your
you
skin.
see results in 1 to 2 weeks with this product.
And it's going to make your skin look brighter. It'll probably shrink your pores. I mean, it'll have some benefits. Now,
I think it visibly, from watching the videos of it, it visibly actually does something. Like you can see it get your pores clean.
yeah. And so I think that's great. Getting your skin really clean is always beneficial to looking better. And what do we have that's comparable to that? We have hydrofacial machines.
Okay.
Which is a really, really aggressive version of that.
Yeah.
You'll have to come get one sometime at the office and see what you think of it.
Okay. Because I've already got an appointment next week.
Oh yeah, come by. But of course, you don't want to come Well, there are people actually that come get hydrofacials regularly. I mean, because it's so good, for your skin. And
Yeah.
it's kind of cool because on the hydrofacial machine, it'll show you what it collects, and it has like this little vial of like.
It's just like
gross
when you have
oil
like
and
those,
stuff. Yeah.
you pull those strips off your nose. or,
Oh,
like,
right.
you
Yes.
know?
Yeah, I know what you're
That's
talking
pretty much what this thing
yeah.
does, except it's just like pushing it
Yeah,
out
I mean,
with the
for
vibration.
at home, I mean, I think it'd be great to use that.
Yeah.
Honestly, of all the three, probably I like that one the best.
It literally, the only cons really of it are
Time.
the time, but it's a learning curve. So the more you use it, the more like the better at it you'll get. So you just have to take some time to actually learn how to do it properly.
Gotcha.
But besides that, it really doesn't have as many cons as the other one. You might,
I would agree with that.
yeah. But honestly, if like you were to buy like all three of these, I think that you would probably just like really have a beautiful face. Honestly.
I mean,
like if you were doing that every day,
yeah.
that would be really good for preventative measures.
As I've said, many, many times on the show, staying young is a rabbit hole.
Yeah, it doesn't, yeah.
How far down the rabbit hole do you want to go?
Yeah.
I mean, there are some great treatments out there that you can get at doctor's offices. There's some good treatments you can do at home. There's some things that aren't really treatments, like wearing sunscreen, having a good skincare regimen. If you do all of those things versus someone who does none of them, you're going to look years younger than that other person.
Yeah, and then sometimes it just comes down to your genetics.
And that's a big one too. I mean, you're always fighting genetics, or your genetics are helping sometimes. But even with your genetics, you still can improve or not based on what you do.
Yeah.
And so there's some great treatments out there. I think the at-home treatments like you're talking about are fine. But what people just need to realize is that you can't buy those things expecting that it's going to shave 10 years off your age.
No.
There are treatments that can do that.
But
maybe
at a
not 10.
professional.
Yeah, but they're more invasive, heavier treatment, bigger result.
Yeah, definitely. I would never be able to buy these products because I am not a consistent
You're not
person.
consistent, no.
The
Yeah.
only thing I have found that I am very consistent in is working out. I am not a consistent person. Like I do not like doing the same thing over and over and over again.
Interesting.
It's
Like
just
the show. Oh, you seem to show up every week.
I know, but I don't it just seems so robotic to just
I know, do the
wake
same thing
up,
over and over. Yeah.
do this to my face, do this to my face.
Yeah, it's a routine.
It's just I don't know. For me, I would not be able to do this because I've actually bought a product for it's for your body. It's like a red light, different wavelengths for your body for targeting stuff. It's like this little round looking ball thing.
Do you think it works?
I don't know. I mean, I only
The
used
jury's
it
out.
probably 4 times
yeah.
because
Yeah.
I'm like,
Yeah.
I don't know.
You should make it next year's New Year resolution to use it for
I know.
6 months straight.
I was getting ready today, and I was
Oh, word.
curling my hair. I was blow drying it or something, and I saw the box, and I was like,
The
and I
box is
pulled it
just
out, and I
mocking
looked
you.
at it, and I was like, I'm going to talk about you today,
It's like, why won't you use me?
Yeah, and then I put it on my bathroom counter, so maybe I'll grab it.
Remember it? Yeah.
So yeah,
You'll have to let me know.
maybe it'll work.
Well, Sarah, thank you so much for educating us about those products.
Yeah.
It's fun to talk about them, and I do think that a lot of these products have some good application. It's just you have to be reasonable about the expectations with them. So, all right, I think that's all the time we have for this week. Thank you guys so much for tuning in. We really do appreciate it. Please come back next week and see what we're going to be talking about on Nip Talk.